Welcome to the Unspoken Impact Spoken.
Hello, my name is Emma and I am a youth researcher from In Our Own Words, and today we're going to be talking about our projects.
My name's Louisa, I'm 20 and I'm also a youth researcher. Our project is about autistic girls and how a lack of early support can affect them later in life with their emotional regulation and well-being.
Hi there, I'm Casey, and my research project's on income and the effect that has on mental health and your daily life.
Hi, my name is Caitlin, and my research question is: how do mental health professionals in education settings feel about their workload and ability to support students?
I'm Laurel. My research question was: how much do mental health support professionals know about autistic burnout, and how is the education around that given?
Hi, I'm Lottie.
And I'm Raven.
And our research is about the impact of school-related stress
and how it's further impacted by waiting for gender-affirming care.
My name's Louisa.
My name is Emma.
We're really excited to be doing this project.
Very excited.
Through my experience of education and being an autistic child, especially an autistic girl, my needs have been quite neglected and not properly understood. I was lucky enough to be diagnosed early, but I was still treated as if I wasn't. It just felt so isolating for me.
It is about essentially how does early support for autistic girls or people assigned female at birth relate to their well-being as they get older, and whether it does lead to any sort of emotional regulation type problems. We mainly hear about the stereotypical white male experience, and I think the route to inclusivity and a greater understanding is being more knowledgeable.
We decided that the best way to go about meeting both of our target audiences was by having the survey for the young people to have a lot of experiences, but then for my one I only did one interview with a professional because I felt like it would be difficult to get a lot of professionals to answer a survey. I spoke to a member of staff from Learning Space who work with kids who have been flagged as potentially having additional needs, and a lot of the people that they work with are autistic.
I wanted to get and reach as many young people as I possibly could to be able to really get a valid response level. We did the research protocol and it got sent to the ethics board, and then they said yes. Essentially, at the end of that, once we got feedback from our professors, we then got a finalised list of questions, and I have got 38 responses, which is amazing, and I was not thinking I was going to be able to get anywhere near that.
What did you find out?
A very, very significant number of my responses all saying roughly the same thing, which is that they have not received support early enough, and quite a few of those people feel like that was due to their gender. And that was really interesting for me because I assumed naively that not that many people would have made that link.
My findings ended up being more based on what the person that I spoke to would put into place if they could, rather than the specifics of what's currently happening. Because I was surprised to find that the groups that they work with, they're quite equally boys and girls. So we were discussing that, especially for autistic girls, it can be really good to have optional support for anyone who might not have even been flagged as autistic, and have it so that that's always optional to dip into and out of whenever they might get too overwhelmed or they think that they're doing better, so that they feel like there's at least some form of help for them. We also discussed maybe a life skills kind of thing for autistic children, because there's a lot of life skills programs for autistic people, but it's mostly for autistic adults who are struggling to function and do chores around the household, for example. especially autistic girls, because I feel like they don't get as many opportunities as autistic boys do.
My research is important because it gives a voice to people who often feel voiceless, and especially autistic girls, because we need to get the message across to stakeholders in healthcare, education, every sector, that there isn't enough support, and actually being denied support or being denied early support really does have a significant effect on your later livelihood. The 38 people that have responded to the survey, they tend to say that schools do support them with their emotional needs, but then rarely go deeper in terms of whether there is any then linked to neurodiversity or autism, perhaps because they feel like they need a more specialist member of medical staff to say that. And then you come back to the problem of they feel concerned about going to the GPs, they feel like they're not going to be listened to. Then how exactly do you actually, access that medical intervention?
I feel like it's very important to have preventative measures rather than only dealing with things when people go into a crisis. And with autistic girls, it would just be amazing if they could have access to services, feel heard and understood for once in their lives, because then less people would end up needing such intensive care as they grow older, especially emotionally.
Hi there, I'm Casey. My project's about, essentially, I focused on income. I wanted to investigate if there's a relationship, like a true relationship between income and the amount of stress you receive, or how well you fit in society based on your income. And does income really play such a big part in someone's life? From an aspect of socio-economic progressivity, my area is quite low on that scale. So it tends to be that public services, the people in my area feel more left out by society. I wanted to have a large sample of data. So I used a survey and my sample size was quite big. I had a large age range and there was no boundary to enter apart from you have to be between 18 and 45, which allowed me to get a huge sample of data to really analyze the results. I found out multiple things. I think the main one was that people with a stronger financial concern, so maybe people that aren't doing as well financially, tend to feel more left out in society and tend to feel like they haven't got a place in society or a voice in society. They tend to have less friends or less people to go out with, or they tend to feel like they don't fit into their circle of friends that they have. When I went into my research, I thought that there would be a strong correlation between stress and the amount of income you earn. But that actually wasn't the case. In people, especially aged 18 to 24, there was actually a very weak correlation between stress and income, which shows that people at a young age don't really have financial concerns. But as you moved up, especially in my elders bracket was 35 to 44, there was a stronger correlation between stress and income. Again, this wasn't very strong, so that was the thesis of my argument. So I do believe that there's a strong correlation between society, how well you fit in society, and income, rather than stress and income, which is what I found from my results. I feel like class disparity or like a division of classes is extremely important, especially in the UK, where you can see or any capitalist society, to be fair. I wanted to make it aware that people on lower incomes will tend to have more harsher view of society and they may see everything more in black and white. And I wanted to emphasize that point of when professionals are looking at people as a whole, they should take into account income and the factor of income, because I feel like that plays such a big part. I think the main thing I've learned is how to not talk to new people, but more like how to socialize better. I've been in my school for 7 years. It's very conservative, small school. So I've had a bubble of friends and the same friends. And only this year I started doing new programs such as this one. And I feel like it's helped me get out of my shell and talk to new people that I wouldn't talk to in my day-to-day life, which I feel like has helped me a lot. As much as I like the research a lot, I haven't had the opportunity to research before, so I feel like researching is a very fun thing to do. But I feel like the main thing is just socializing with new people and able to talk to people about their results and my results and compare and peer review. And I feel like, that's definitely the best thing about this project.
Hi, my name is Caitlin. I chose this topic because to me, support in education, whether that's school or college, is really important. And from my own experience, I have found that has not been enough, and that I feel that all students should be able to have support when they need it as soon as possible. And I decided that interviews would be the best way to get first-hand information and I chose from a college familiar to me so that it would be easy to get in contact with them and the process could be quick. I found that lots of the staff wanted more staff members to join their team because they found that they could always get more work done, except there's always not enough time, and they always wish that they could help more students. I was shocked with how much that has changed with how many staff members work in mental health in education now, and how limited the support was before I did this research. My research is important because I think that it would highlight how little support there is in education and how extra funding could make a difference to a lot of schools and students and even staff themselves. I have learned a lot either from the actual practical side of it all to learning different techniques and even learning how to get on with different people and how to work as a team but also work individually. My favourite thing about this programme is being able to work on something that I enjoy and am passionate about, and also getting to work with new people and hearing their interests and just finding new people to hang out with.
I'm Laurel. I chose my project because both myself and people I know have been through autistic burnout and found that there are huge gaps in the knowledge of professionals in mental health around autistic burnout. I sent a survey to multiple professionals. I found that mental health professionals, even who specialize in autism, find their education in autistic burnout to be lacking, and we're often not given specific teachings or courses around autistic burnout.
Was there anything that surprised you?
The amount of professionals that were aware of how lacking their knowledge and education was, and who were willing to say, I was not taught about this, I feel like I should have been taught about this. There are going to always be autistic people in burnout who will suffer because professionals weren't able to identify it, and maybe they weren't diagnosed, but they were still in burnout and suffering because people don't know about it. I learned a lot about how to conduct research and what methods can be used to conduct research effectively and how to use those methods. I've really enjoyed getting to meet new people and being able to do research that will hopefully have an impact and make other people not have to suffer the way I have.
Hi, I'm Lottie.
And I'm Raven.
I initially came onto the project wanting to look at the impact of school-related stress for kind of high-achieving students or students that have a more than average workload. I myself am overachieving academically, but also in my extracurriculars. That whole realm which is so separate to college, and it takes up a significant amount of my time outside school.
And along a similar vein, I came into the project thinking about trans youth and how being trans is a massive additional stressor in life, whether that be a social stressor or the financial stress, and even the amount of forms that need to be filled out, etc., etc. And I really wanted to investigate just how much it impacts youth and compare trans youth experiences to non-trans youth experiences.
But then me and Raven met doing the project. We got along really well and kind of got talking about each other's ideas. And I personally, openly saying I didn't actually know much about young trans people's experiences. And I was so interested in what Raven had to say and I wanted to learn more. And equally Raven.
Yeah, both of my siblings overachieved inside and outside of school, and so had a lot of stress. And so we began writing our survey, and we thought about doing interviews. Then with both of our workloads, we realised that it was not feasible.
Not achievable.
At all. We looked up a stress scale, which we found one called the PSS-10, and put that into our survey first off. And then we wanted qualitative data and quantitative data.
A lot of key themes that came out of the schools-related stress part of our research was academic pressure, social environment and peer relationships, sensory stresses, a lack of inclusive support and barriers to effective mental health support. Students frequently describe stress as being linked to workload, organisation and expectations around performance. We got comments like, I wish teachers didn't put as much pressure on grades or tests, but also beyond that, just the school environment itself, busy corridors and classrooms, being away from home. And when there are massive barriers to effective mental health support, how do you overcome that? Students said that even when support was available, it felt like they didn't have time. They couldn't build a relationship with the counsellor, which made it feel pointless. Meetings were often short and unhelpful. I think we can definitely learn from this research that school is clearly stress-provoking, and therefore we need to increase the amount of support available.
Yeah, and this is further backed up by quantitative data. 28% of people said that friendships were the second most stressful thing to do with school. But 54% of students said that tests and exams were the most stressful part of school, and then expectations from themselves, which demonstrates how much stress these students go under and are pushing themselves, encouraged by schools, with lack of support, leading to a lot of them not knowing how to cope with the amount of stress they're under. Our results also show that 17% of students didn't even know that their school provided mental health support.
The second part of our research was looking specifically at trans young people and how being on the waitlist for gender affirming care furthered the school stress. We received feedback that gender identity related stress in school is massive. Trans students describe school as a space of heightened vigilance and identity management and fear. It's hard having your identity debated over was a comment that really stood out to us, because you're already in an environment that's anxiety provoking, and then when you feel like you can't be yourself because you feel like people don't understand you is really difficult. We've got a comment here that says 3-4 year struggle on the wait list. With that going alongside the stress of school, it must be so difficult for these students.
100%. And the mean stress score for students was 25 out of 40, which suggests that 62% stressed on this scale. And trans students have so many extra stresses, as we see in the qualitative data and the personal accounts.
There was not a single person in our survey that suggested school was not significantly stressful to them. And that is massive, because we spend so much of our young adulthood, childhood in school.
Seeing the results, as I'm analysing them, one participant scored 37 out of 40 on their stress scale. And you can understand their stress with all the different age ranges that we had, 13 to 18. There were so many different aspects and perspectives, and it provides evidence of the things that we see every day. When we go to college, when we go to sixth form, when we go to school, we see kids crying, we see people leaving classes because they are so stressed, and we hear our friends not only complaining but physically showing their stress. And being able to prove this with evidence for this struggle and how to actually help this struggle just drives us to push our research and findings out.
But maybe schools need to stop considering how to increase the attendance and start looking at why the attendance is so low. It's clear it is not a nice environment for so many people, so why would students want to go into school? We need to work together to make it a better place.
Thank you for listening to our podcast.
By In Our Own Words Youth Researchers. Supported by Surrey County Council and the University of Surrey.
That was actually really good.
Yes!
This is a Make Good Trouble production.